Hello, I'm Ruth Hansten, and I'd like to welcome you to our new three-part series of Leadership at the Point of Care. This series has been designed based on the questions and concerns that have been raised at the workshops and webinars that I have done over the last few years across the nation. So we have addressed those concerns and those topics that we think will help prepare you and your teams to be the most effective at delivering optimal care for our patients and our communities. We believe that if RNs are effective at leading the care team, if they delegate and supervise appropriately, then care will be done appropriately and care will not be missed. Therefore, not only will we have better clinical outcomes for our communities, but also that we will avoid some of those hospital-acquired conditions such as deep vein thrombosis, loss of function or deconditioning, pressure ulcers, falls with injury. So that being said, I'm going to outline the three parts of our series. We begin with our first part of our series, Clinical Delegation, Supervision, and Teamwork. In this part, our first part of our series, we're really focusing on individual professional practice. And we're looking at nurses being more aware of what the ANA and the National Council of State Boards of Nursing Joint Statement on Delegation looks like, where they might find their Nurse Practice Act, the 5 rights of delegation and supervision, and why we should care, looking at the evidence around teamwork and the difference it makes when nurses lead effectively. So that was part 1. In part 2, Blueprint for Successful Clinical Supervision and Teamwork, we take the concepts explored in our basic individual professional practice and apply it to the actual workplace setting, looking at unit configurations, looking at the way our care is structured so that initial direction, periodic follow-up, and debriefing occurs on a regular basis. In the third section, however, we've really looked at the idea of how to make assignments. What are the criteria that we use? And this is specifically for acute care nurses, so that they can begin to look at different ways that they might be able to deploy the resources that they have available when they're working with assistive personnel. We really welcome you to join us for this series. In each part of the series, you will find that you will have a syllabus available, worksheets and tools, other video clips that will help you in your learning process, and there's also a videotaped webinar that describes the slides that can be also downloaded in a slide deck. Thank you for joining us in this overview of our 3-part Leadership at the Point of Care series, and we hope you will join us.